Hello, ladies and gentlemen. Today I'm going to discuss with you a very important topic. This is concerning the coronavirus and the disease which is infecting the whole world at this moment in time. It is an infectious disease caused by a new virus. What does it cause? It causes respiratory diseases with flu-like symptoms. A person is always having a cough, a fever, and in most severe cases, difficulty in breathing. The patient becomes breathless. A person can protect yourself by doing a couple of things. Number one, washing your hands very frequently, avoiding touching your face, and even avoiding close contact at least 1 meter free with anybody, including your wife or children, and even your pets. How does it spread? It spreads basically through contact from an infected person when they cough or sneeze. It can spread when a person touches somebody, and it could be a subject or an object which has the virus on it. It is a new strain of the viruses which was discovered in this 2019 and has not been previously identified in humans. Usually, using the data which we have, the median time from onset to clinical symptoms for mild cases, which is for most of us, is approximately 2 weeks, and 3 to 6 weeks for patients who are much older, who've got diabetes, hypertension, old people. At the same time, I have to tell you that people of all ages can be infected by this virus, especially those with pre-existing conditions, diabetes, heart disease, and asthma, and they're becoming more vulnerable. So if you have a fever or cough, difficulty in breathing, I suggest you seek medical advice immediately. Stay at home, don't go out anywhere. If you feel unwell, you can take a cup of warm water. If you have fever, cough, and difficulty breathing, then you should seek medical advice immediately. When you're in your flat or in your house, practice frequent hand hygiene. Wash your hands regularly, every 10 minutes. And also when coughing and sneezing, cover your nose or your mouth. And you clean and disinfect your objects and surfaces, your bed sheets, your everything. Even for people, the toys and door handles within the house, they should all be cleared. Now, if you have a family member, which many of you may have, an old person or an old relative, he needs to have frequent care, and you have to provide care for them. Um, Only one person should meet this person and provide care, and do not share your personal items with this person. Um, what I mean by personal, do not share your toothbrush, towels, or even bed linen, and you use a separate bathroom for this person. If not possible, if they're using the toilet, if possible, the person should put the toilet down before flushing. Remember, you can catch the infection by touching contaminated surfaces or objects. These include eyes, nose, and mouth. Um, I have to say there have been few cases of this virus being reported among children. In this respect, I have to tell you that there have been 4 such pandemics within the last century involving this category of viruses. The first was in 1918 during the First World War. That was the first pandemic. It was called the Spanish flu. The second pandemic was in 1957 to 1958. The third was in 1968. And there was one in 2009, the H1N1 pandemic. As far as food goes, there is no evidence to suggest that food is a likely source or route of transmission, and there are currently no reported cases of the virus being transmitted through food. People are unlikely to be infected with the virus through food. Although scientists and food scientists all over the world are monitoring food. If you become aware of a potential food safety risk, you should take appropriate connection and inform the health authorities in your region. I have to mention coronaviruses are killed by common cleaning and disinfection methods. and by cooking food using safe internal temperatures. Mass gatherings and events are not to be done. Things like going to church or going to the mosque or to the synagogue have to be curtailed. Sporting events like games and field track runs, festivals, and conferences have to be avoided at all. As of today, on the 2nd of April, I can tell you that more than 937,000 cases have been reported in over 200 countries. The number of deaths are 47,200. And at the same time, I have to be an optimist. More than 194,000 people have recovered. In conclusion, I can confidently say that it will be less destructive than any of these other the three pandemics which we had in the past. That's all I can say for now, and things will definitely get better as time goes by. Thank you, ladies and gentlemen, and have a nice day, and do what I said. Bye.